Welcome, this is Pat Ocasio. World AIDS Day is observed on December 1st each year. It's an opportunity for people worldwide to reunite in the fight against HIV and AIDS and to show support for people living with HIV and AIDS, and to commemorate those who have died from an AIDS-related illness. Founded in 1988, World AIDS Day was the first ever Global Health Day. Some of you with us today remember what it was like living through the very early and uncertain days of the HIV and AIDS epidemic. Some of might have been around but too young to recall, and some of you weren't even born yet. Our agency history was firmly planted roots in the HIV and AIDS community, and it is vital that we never forget where we came from. In 1981, the CDC issued its first warning about a rare form of pneumonia among a small group of gay men in Los Angeles, California. In 1982, the New York Times published an alarming article about the new immune system disorder, which by that time had affected 335 people, killing 136 of them. Early on, because the disease appeared to affect mostly gay men, officials initially called it gay-related immune deficiency, or GRID. By the end of 1982, the CDC used the terms of AIDS for the first time. Though the CDC discovered all major routes of the disease transmission, as well as that of female partners of AIDS-positive men, could be affected. The public considered AIDS a gay disease, even referring to it as the gay plague for many years. As the HIV and AIDS epidemic advanced, fear, ignorance, and prejudice, homophobia, cultural stereotypes, and racism, and stigmatized not only those who were affected, but those who were believed to be infected. Most specifically, members of groups identified by the CDC as being high-risk, homosexual, Haitian, intravenous drug users, and homophilics. Among the consequences were social isolation, discrimination, loss of employment, and they were prohibited against donating blood, denial of medical care, and lack or access to services. Our agency was formed in 1983 by a small group of volunteers living in Westchester County in response to the emerging AIDS health crisis and the devastation it was causing in our very own communities. We opened and operated the very first HIV and AIDS phone hotline in the region. We also started a buddy program. In our early days, we were a place for those infected and affected by HIV and AIDS to go get information and connect with others going through the same struggle. Many working in the field at the time felt like they were working in a triage unit or a war zone. Our co-founder and first executive director, John Egan, recently said, "I mean no disrespect, but you have no idea what it was like working through those years." It was a war zone, with death all around us. In 1984, researchers finally identified the cause of AIDS, and the HIV virus, and the FDA licenses the first commercial blood test for HIV in 1985. In 1986, our agency incorporated to AIDS-related community services. In an era where even hospitals refused to treat AIDS patients, we were the first agency in our region offered on-site client services. In 1987, the first antiviral medication for HIV, AZT, became available. Our agency begins prevention work in local methadone clinics. By 1990, there are at least 100,000 of cases of AIDS in the United States and about 400,000 cases worldwide. In the early 1990s, our agency pioneered HIV prevention education among New York State incarcerated individuals and piloted the Prisoners AIDS Counseling Education Program. In 1982, AIDS became the #1 killer of men between the ages of 25 and 44. Our agency opens the doors and food pantry begins, and also transportation program. In 1994, AZT is given to pregnant HIV positive to reduce maternal infant transmission. The first oral HIV test is released, and AIDS is the #1 killer of all citizens between the ages of 25 and 44. In 1995, there are now 500,000 cases of AIDS in the US. In 1996, AIDS cases decreased. The FDA approved HIV home test kits, viral load testing, and the first NNRA/TI antiviral drugs. By 2007, over 450,000 US citizens have died from AIDS. In 2011, there are significant breakthroughs in PrEP research. And in 2014, a partner study finds zero sexual transmission of HIV between viral suppression individuals and their HIV negative sexual partners. As you can see, our agency has remained steadfast in our continued commitment to seeing an end to the epidemic. While we have come a long way, we still have so much work to do. Currently, nearly 1.2 million people in the United States are living with HIV, and about 14% of those people that are infected do not know that they are. While newly diagnosed cases have decreased, rates among MSM communities of colors continue to rise. Our work isn't done. Hudson Valley Community Services, we still have a lot of work to do, and I congratulate you for all the hard work until today. Thank you.
Since the 1980s, more than 2/3 of HIV annual infections in the United States have dropped, which is fantastic. Less people are getting sick from HIV, rapid testing is highly accessible to most people, medication is highly effective and much more readily available, and people are educated about HIV in far higher numbers than at any time. However, it's not all good news. Roughly 1.2 million people in America are living with HIV. 14%, which is 1 in 7 people, do not know that they are positive and need to be tested. In 2018, approximately 36,400 people were diagnosed with being HIV positive. Indeed, between 2014 and 2018, progress seems to have stalled as approximately 38,000 people contracted the HIV virus on 4 consecutive years. This trend is set to continue. Furthermore, statistics show that particular communities such as MSM, transgender people, communities of colour, and Hispanic and Latinos are disproportionately affected. For these reasons alone, there has never in recent years been a more important time for us all to do as much as we can to continue to help reduce the numbers of people affected by HIV. Through education, testing and increased awareness and understanding of the virus, we can all continue to make inroads in reducing the impact that the HIV virus has on our communities, our families, on individuals and our loved ones. Here at Hudson Valley Community Services, our main priority is to provide as much support as we can to people directly affected by HIV. Through education and HIV testing, we provide vital services to those who may be at risk of contracting the virus. Through our numerous media activities, HVCS continues to highlight safe sex and drug use practices as a way of safeguarding against infection and transmission. HVCS is well equipped to offer many services for people who are living with HIV. Programs such as Thrives educates people about healthy foods, provides demonstrations on how to cook healthy meals, and provide people with food. Staff throughout the organisation are able to make appointments for clients' health checks, take steps to organise transportation for those people to attend appointments, and refer clients to the education and prevention team for HIV, Hep C and STI testing. With regards to HIV rapid testing, a number of organisations in our immediate communities offer this service, and on most occasions the process takes a relatively short period of time, roughly 20 minutes. However, this is not the case at Hudson Valley Community Services. Quite literally, our testing sessions last as long as the individual needs. This could be 45 minutes or 2 hours, for example. The reasons for this are clear. HVCS does not just provide HIV rapid testing, we discuss the virus with the client. We help them to understand how the virus works. We analyse ways in which a person can be at risk of contracting the virus. We illustrate ways to prevent contracting it, for example, using condoms, negotiating safe practices with partners, understanding medications that are designed to help keep individuals safe, and abstinence, although this is not always a realistic option for the client. During our testing procedure, we explain the equipment we use and what we are testing for, the presence of antibodies and antigens. We explain what would happen if the person tests reactive for HIV, what that means and the next step. We discuss what a dry blood spot test is and why we do it. And we reassure our clients that if they test positive, we will be there for them every step of their journey, discussing their fears and concerns, making and/or attending doctor's appointments, checking in on them in order to make sure they are emotionally safe and that they have their medication. We stress to clients that if they take their medication as prescribed and look after themselves, they stand an outstanding chance of suppressing the virus to undetectable levels, and when this happens, they no longer can infect anybody. We also explain what undetectable means, how best to maintain being undetectable, and the ramifications of not taking their medication as described by their doctor, i.e., their viral load may begin to rise. In short, we want to help clients to not just know that undetectable equals untransmittable, but also to understand why that is and what the implications are for themselves and other people in their lives. This conversation is part of the wider discussion we would have with the client about the HIV virus and their understanding of it and how it works and affects their body. In the case of pre-exposure prophylaxis or PrEP, we illustrate that this is a way for people who do not have the HIV virus but who are at very high risk of contracting it to prevent infection by taking a pill, and that this reduces the risk of getting HIV from sex by about 99% when taken daily. We also stress that among people who inject drugs, PrEP reduces the risk of getting HIV by at least 74% when taken daily, and also PrEP is much less effective if it is not taken consistently. One issue that HVCS testing staff highlight to clients is that PrEP only protects against HIV, therefore condoms are important for the protection against STIs. Further, condoms are also an important prevention strategy if PrEP is not taken consistently. Clients are also informed that PEP, or post-exposure prophylaxis, consists of a number of the medications used to treat HIV. The medication is designed to prevent the HIV virus from establishing itself in the body. Clients are informed that it needs to be taken no longer than 72 hours after the possible exposure to HIV occurred. The sooner the better. If taken after 72 hours, it is considered that the HIV virus will most probably have had enough time to establish itself in the body to an extent that it renders the effects of the medication as being inadequate in its ability to suppress the virus. Taken prior to 72 hours, again the sooner the better, there's a significant chance, although not 100%, that the medication will work. During our testing sessions, HVCS staff invites clients to ask questions about, well, anything to do with HIV. HVCS's philosophy is, the more an individual knows and understands about the HIV virus, the better. How it affects the body, how to stay safe, what medications are available, and how they work. We make clear to clients that they can call HVCS staff at any time for advice and assistance. HVCS staff will provide condoms, dental dams, lubrication, and education materials free of charge, anytime, available in all offices. Clients are made aware that they can watch educational podcasts and videos and are encouraged to attend HIV, Hep C, and STI webinars and group trainings regularly. HVCS knows that there is still plenty of work to be done in continuing to reduce the amount of people contracting the HIV virus both in those New York State counties that we work, but also the US as a whole. We know we have a responsibility to provide testing free of charge, to educate, to provide materials such as condoms, lubrication, dental dams, and education materials, and inform clients as much as possible about the virus, how it affects the body, ways in which it can be transmitted, how medication works to treat HIV, and prevent it in the case of PrEP and PEP. Our aim is to help rid the virus from our societies, our friends, our family members, and our loved ones. Only when we can talk about the HIV virus in the past tense will we stop fighting. I would like to share a story with you as an illustration of how HVCS's dedication to our clients and their desire and willingness to go the extra mile to help them resulted in the client's partner receiving services that enabled them both to breathe a sigh of relief in the moment and take steps to protect themselves going forward, but also providing them with long-term peace of mind that brought much needed comfort to them as a family. Client A, who is HIV positive, was receiving support from HVCS's Health Homes department for various services. They asked their care manager if she could talk to their partner, we will call them Client B, in an effort to help them understand the HIV virus. The care manager asked me if I could help and would I speak with Client B if both partners were agreeable. Of course I said yes. Once it was agreed that I would speak to Client B, I was then informed that they did not speak English and that the care manager would have to interpret between English and Spanish for both of us. During our conversation, I informed Client A and B details about the HIV virus, how it is contracted and transmitted, how it affects the body, the importance of taking medication, and how best to protect against it. I also ascertained that Client B had not been tested for HIV in a long time, years, and that the worry that they may have contracted the HIV virus from their partner was real for both of them. With their agreement, I organised an HIV test for Client B and provided them both with condoms, lubrication, dental dams, and discussed the various ways they could protect one another from going forward. In time, Client B was tested for HIV, Hep C, chlamydia, gonorrhea, and syphilis, and proved to be negative for all. It was during these sessions that I discussed the possibility of them taking PrEP as a measure of protecting against HIV from their partner. They agreed and were enthusiastic about the possibility. However, there was one major problem. The client was an undocumented resident with no form of identification. They were working illegally and had no health insurance or any way to receive it. What could we do? I asked Client B to give me some time in order to do some research and look for possible ways to overcome the hurdles facing us. They accepted this. Both Client A's care manager and I made numerous phone calls and learned what to do in order to overcome the problems we faced. We realised, for example, that we could ask employers for an anonymous reference authenticated by a signatory, proving that Client B had a job and could pay some money as a co-payment for medication. We received a reference from the couple's landlord, proving that Client B lived in the United States. We helped Client B receive a basic form of identification in order that they could show who they said they were when needed, a basic privilege that many of us take for granted. 7 months from the point we started, both the care manager and I managed to arrange Client B's first appointment to begin the process of being assessed to be available to take PrEP. At times, I never thought we would be able to achieve what we did, but with a little bit of tenacity and belief, we succeeded in the end. What began with a simple educational chat about HIV resulted in a client receiving frequent HIV tests and overcoming many obstacles that allowed them to begin taking PrEP. I know this was a huge deal for client A and B and their family. I am very proud that client A's care manager was able to invest as much time and effort as I was afforded and to be able to help a family in such a profound way. I am so thankful to my supervisor and to HVCS as a whole for their willingness to go whatever length it takes to help their clients. I am also very proud of client A and B for their courage and determination they showed throughout the whole process and the trust they put in us.
The ETE 3-point plan began June 2014, initiated by New York State Governor. The 3-point plan included identifying persons with HIV who remain undiagnosed and linking them to healthcare, linking and retaining persons diagnosed with HIV to healthcare and getting them on anti-HIV therapy to maximize HIV viral suppression so they remain healthy and prevent future transmissions. And 3, providing access to pre-exposure prophylaxis or PrEP for high-risk persons to keep them HIV negative. Since the inception of ETE, New York State has seen success through epidemiological data, including continued decreases in new HIV cases, continued increases in linkage to care within 30 days of diagnosis, and significant increases in PrEP utilization, as well as strong evidence that we are indeed bending the curve. In 2019, the director of the AIDS Institute fine-tuned our efforts in addressing ETE goals to include addressing the issues of concurrent HIV and AIDS diagnosis by making routine HIV testing truly routine, fine-tune recruitment efforts of testing programs, ensuring all individuals with a concurrent AIDS diagnosis are afforded rapid initiation of HIV treatment, combating HIV stigma in every venue with every tool we have so that people are not afraid to have an HIV test, engage in HIV care, or take advantage of PrEP. Addressing the unique needs of older adults living with HIV, ensuring that certified peer workers or CPWs are interested in working full-time, have access to salaried livable wages, and expanding access to PrEP in all eligible individuals and populations. In 2020, the state added additional goals to Ignite programming. These additions are to make gains across every population and community, enhancing safety for people who feel marginalized, bridging the gap of mistrust in healthcare and public health, improving the underlying social factors and addressing unequal access to HIV testing, rapid treatment initiation, PrEP, and the benefits of healthcare. The following priorities are to be taken into consideration. Apply a health equity framework. Apply a sexual health framework. Address HIV, HCV, STIs, and opioid overdose as a syndemic. Implement trauma-informed care, and meet the needs of long-term survivors. Moving forward, HVCS will continue to work toward these goals and priorities post-ETE planning. Thank you.